Welcome to RUMC Connections. Welcome to RUMC Connections. My name is Meredith Gaskins, and I'm joined today by Jenifer Sacaccio, licensed mental health counselor and the program manager of the Center for Young Adults, and Liza Schatzman, therapist in the Center for Young Adults. So through RUMC Connections, you'll meet the fantastic doctors, nurses, and medical professionals that make our hospital thrive. We'll get you answers to some of your own health-related questions, explore the latest medical news, and provide you useful information about your own health as well. So RUMC is proud to offer a full continuum of behavioral health services ranging from inpatient and outpatient care, counseling to crisis intervention and substance use treatment. So today we're focusing on one of the most specialized and forward-thinking programs within that system, the Center for Young Adults. Located at 1130 South Avenue, the center is uniquely designed to meet the needs of individuals ages 11 to 24 who are facing both mental health and substance use challenges. This dual-diagnosis program provides developmentally appropriate, compassionate, and evidence-based care supporting not only the young people themselves, but also their families and communities. So today we'll discuss the unique needs of adolescents and young adults, the power of community partnerships, and how early personalized intervention can change and even save lives. So joining us today, like I mentioned, is Jenifer, a Staten Island native who brings both professional expertise and deep community roots to her work. Jenifer is a licensed mental health counselor and the program manager at the Center for Young Adults. She holds a master's degree in clinical mental health counseling from the College of Staten Island and has dedicated the last 6 years of her career to working with individuals affected by addiction. Jenifer's approach is both compassionate and clinically robust. She's trained in cognitive behavioral therapy, motivational interviewing, dialectical behavioral therapy, EMDR, and more. She's worked extensively with individuals negotiating legal involvement, homelessness, grief and loss, trauma, and co-occurring disorders. So in her current role, she oversees services designed specifically for youth and young adults aged 11 to 24 who are facing both substance use and mental health challenges. Also with us is Liza, a longtime RUMC team member who has been part of the hospital's behavioral health family since 2001. A wife and mother of 4 teenagers, Liza began her career at RUMC in the day treatment program, where she supported adults with chronic mental illness through both group and individual counseling, with a special focus on promoting healthy living. After a brief stint on the inpatient unit, where she especially enjoyed working with adolescents, Liza was tapped to help launch a brand new outpatient program, and she became the first person hired at what is now the Center for Young Adults. So we have a veteran with us today who's been through it all. Back in 2019, before the program even had a name. So since then, she's been a clinical mainstay, helping to shape and grow services for young people living with co-occurring substance use and mental health disorders. Welcome. Thank you so much for joining me today. I'm excited to chat with you both.
Yeah, thank you for having us.
So can you maybe give us an overview of the Center for Young Adults, its mission, the age group that it serves, what makes it distinct within the behavioral health services at RUMC?
Yeah, so the Center for Young Adults, or what we call it CYA, is the only program in the RUMC network that is a New York State Office of Addiction Services and Supports.
Okay.
So it's, or OASIS, the clinic that targets adolescent substance use and mental health disorders. We help treat 11 to 24-year-olds. In Staten Island, there are very few clinics that address these issues for the younger population. So a lot of existing clinics on the island serve 18 to 18 plus. And so there's not a lot of adolescent programs on the island. So our mission is to provide a compassionate, calming, and comfortable setting and tailor services that is unique for that person.
Many people may not understand what dual diagnosis means, so maybe you can explain what that looks like in young people?
Yeah, so dual diagnosis means that they are diagnosed with a mental health disorder and a substance use disorder.
Okay.
So that could be anxiety, depression, bipolar, schizophrenia. as well as substance use disorder.
Okay.
Treatment for both conditions occurs simultaneously. So both issues are getting addressed at the same time. That can look like behavioral health therapy, that can look like medication, inpatient care, and also group treatment.
Okay.
We have to look at whether the substances are causing the anxiety, depression, psychosis, or is it substance induced, or is it happening organically?
Okay.
So many drugs can also mimic mental health disorders, as we know.
Yes, we see that a lot with the marijuana use, especially
Really?
with using the wax and the pens because it's so potent. We're
Okay.
seeing a lot more of the substance-induced psychosis. We have to really tease that out a lot.
Really?
Yeah.
Okay. Huh. I was unaware of that. Wow. So what would you say maybe are some unique, clinical or emotional challenges when you're working with this age group, especially when mental health and substance use disorders, might be present at the same time? I could imagine that that's a challenging age range to, you're not speaking to an adult, so yeah.
Right. It has its challenges for sure. I think social media is a big piece of it, to be honest with you. I can kind of see what's trending on TikTok when my clients come in, to be honest.
Really?
Because a lot of clients will start to question, am I blank, whatever blank might be. It might be autism or ADHD or, am I neurotypical or not, and all these things.
Wow.
So that's definitely one of the challenges, kind of teasing that out and
Okay.
separating social media from who you are as an
From
individual.
reality.
That's a big one right now for sure.
So Jenifer, you mentioned, a background in trauma and attachment. So how do these early life experience manifest in substance use behaviors among the youth?
So many children and teens, they go through very real experiences as they grow up.
Mm-hmm.
And that can include any type of abuse, physical, emotional, sexual abuse, loss of a caregiver, grief and loss, violation of boundaries, and that can carry over to when they get to high school, where that continues, and that looks like bullying and community violence and intimate partner violence. Very real experiences.
Mm-hmm.
That creates a lot of anxiety, shame, blame, a lot of negative thoughts, depression, things like that. And so what do people do with these issues? Especially when you're young, you don't really understand what's going on.
Yeah.
And so you may fall into the wrong crowd, you may get curious, and then that becomes a whole escapism where now, Liza was talking about, pens and marijuana use, that starts becoming a way, it becomes a habit, and it becomes a way for you to cope with this anxiety, shame, blame, negative thoughts.
Mm-hmm.
And so that's how it just starts escalating to other drugs, like from marijuana to heroin to cocaine as you get older.
So I know you also emphasize a person-centered, developmentally appropriate care. What does that mean in the practice of a 15-year-old, say, versus a 22-year-old?
There's definite difference.
Yeah.
Something that we all do at the clinic is we're very person-centered. We're very meet your client where they're at, and that tends to be a lot with substance use, but it's a lot with mental health also. So when you're addressing a 15-year-old, you're really looking more at the social pieces, that's really important to them. Not to say it's not important to a 22-year-old, but that's kind of their complete existence. Where do I fit in my school, in my family, in my team? So kind of like addressing that and making sure we address that as clearly and close to what their experience is as possible. When we're looking more at the 22-year-olds, what I've seen a lot in sessions is there's a lot more of the, what am I doing with my life? How do I figure things out? I'm not going fast enough. What am I going to do in college? What am I going to do after college? Am I going to make enough money? Like all those bigger life decisions, and like, again, meeting them where they're at. Like, okay, let's figure this out. Maybe you need help with budgeting. Maybe you need more support in terms of vocational supports or educational supports and that kind of stuff. So that's where it really varies for sure.
Okay. And do you find with these ages, do they do better working individually? Do you do group sessions with them? What seems to be the most effective form of reaching them?
We do have both.
Yeah.
But with this age group, there is more of, I don't want to call it exactly an anxiety, but there's more of a, am I going to fit into the group
Gotcha.
kind of piece. Like I worked in Silverstein when I was first brought over because the clinic wasn't running fully yet. And you could see that they were very open with their stories. They were ready to share and all the things. I even saw that in CDT. With the younger adults, there's more of a, am I going to be okay? Can I share this? So we have to really create like this extra supportive environment.
Yeah.
They really respond a lot well to having an activity, and then
Oh.
that helps them talk more. So we've been doing a lot of art, and then all of a sudden these conversations, the clients
Just
really
start
starts
flowing.
connecting. Yes,
Wow.
that's been really helpful.
Oh, that's interesting.
Yeah.
Jenifer, I know you're trained in a number of therapy models, from CBT to EMDR. How do you decide what approaches are most effective with this population?
Yeah, that's a very good question. I love being equipped with such a wide-ranging toolbox when
Yeah.
it comes to being a clinician and working with clients.
Mm-hmm.
I feel that if I have all these different things to work with, if one doesn't work, I can just use another one. If one doesn't work, I can just use another one. And that is amazing feedback to get. Like I've had clients where I may sit in silence and they'll just start flowing with ideas and they'll just tell me whatever's going on and they fill the space. Or they may not like that silence and then they're just completely silent. And that's great feedback. And then, some clients, they respond very well to question
Yeah.
and having it more of a conversation.
Mhm.
That's great. Those I get. So by being trained in all these different modalities that I know works for substance use as well as trauma, I already know I'm doing a good job as a clinician by giving them these techniques.
Okay. And how about for
Agreed.
yourself? What do you find works best, or do you like to?
Something I found, I guess maybe being a mom of 4 helps.
Oh, yes, absolutely. Especially
Hearing,
teens.
yes, hearing what they have to say,
Mhm.
and again, sometimes there is that silence in the room because,
Yeah.
especially, I think with me, I have an awareness of they see me, okay, there's the mom, you know what I mean? So I
Yeah.
get that. So I can feel if that's happening. But just hearing what they're saying and allowing them to express themselves, because a lot of times they want to express themselves to a parent or a caregiver, but the fear of how are they going to react? Am I going to be grounded? Am I going to be in trouble? All that stuff stops them from expressing themselves. So I'm a big believer in whatever age I'm working with, like really giving them the space. Like this is the non-judgmental zone.
Yeah.
Like you need to say what you need to say. It's okay. It's nothing's bad. Nothing's wrong. And I feel like that really helps the therapeutic connection and helps them open up and feel safe. And that's really where the doors start to open.
Yeah, I'm sure once you establish that trust, that it really makes both of your jobs a lot easier.
Definitely.
Yeah.
Definitely.
Okay. And what do you do in a case where maybe, it's taking longer and you're not breaking through, that trust barrier? Do you ever run into that issue?
I mean, we're lucky we have a team. I mean, that's something I know I appreciate a lot.
Yeah.
I never feel like alone
Uh-huh.
there,
That's
meaning
great.
if I'm struggling with a client, like I know I can knock on Jen's door or just kind of barge in if I needed to, like help, or talk to another clinician and
Yeah.
kind of see, any other strategies they might think of or, suggestions they might have is really helpful.
Very nice.
It's beneficial to just meet them where they're at. Like if I have my own agenda of like, okay, let's work on relapse prevention, let's work on this, that may not jive with the client and they may want to talk about what's going on with their family. If I keep pushing on this issue, they're just going to shut down and, no work is going to be done.
Yeah.
So, what, let's talk about what's going on at home. And then that way I can probably work my way into relapse prevention and go that way.
Find a way to segue into it. That makes sense.
Exactly.
Yeah. Okay. So
Yeah.
it's about meeting them where they're at and, dealing with the moment, basically.
Yeah.
Okay. Liza, how do group dynamics differ in this age group compared to adults? What would you say the benefit of group work is for young people in recovery?
I love group,
Yeah.
personally. Again, I came from a program, it was all mental health and it was majority groups, less individual. And I saw what group can do. Group
Yeah.
is healing. And I think today, I hate to mention social media again, I'm sorry.
No, it's
but
fine. It's a big influence on everything.
It is. And I feel like it's increased isolation so much. So it's actually even more vital for this age group.
Yeah.
They need it. They need to connect. They need to feel safe connecting. They need to remember how to connect without utilizing some sort of app or messenger or whatever it might be. So I think it's extra important for them for sure.
Okay. And when you work with groups, what does the group size look like? Are they small group? Are they big?
Small.
They're small.
Yeah, they're definitely small. We're definitely working on that growing. I feel like if, the more clients feel comfortable,
Yeah.
the more they'll come more consistently and it grow from there. We have one client in particular, he always comes to my Wednesday group and I tell him, I'm like, you're starting it here, bud. You're making it happen.
Oh,
like,
that's great.
So it definitely helps as they feel more comfortable, it'll grow more for sure.
And how many times is group therapy offered in a week?
It's Tuesday through Thursday.
Tuesday through Thursday. Okay.
Yeah.
So how important is family in this recovery process? And, how do you work with families, especially when there may be, dysfunction or denial? Do you bring family into the picture for sessions?
I often call our program like the family program because you can't just work with the child.
Of course.
Looking at the family dynamics, looking at how much is the child heard or not, supporting the parents also. We do offer what's called the significant other track also, meaning we can work with individuals who are affected by someone else's substance use. So we can have parents have another therapist. So if I'm working, let's say, with a 16-year-old, and their parent really needs extra support, they can work with another clinician for their own therapeutic services to give them support that way. We can do family sessions as well. I've had families come in and out of crisis, depending, to either just work on family, connecting more, or my kid really needs help. We need to get them to a higher level of care. How do we do this? So we all kind of work collaboratively.
Okay.
Sometimes with the family, the parent also has a substance use disorder. So then in that case, we refer them to our adult program, Silverstein Center. And that way the child's getting drug treatment and also the parent's getting drug treatment.
Okay. Yeah, very important. Yeah, it's great that RUMC offers, services for both the youth and the adults alike. Yeah, so that everybody can get the treatment that they need.
Yeah.
Sure. Okay. And so you did mention some partnerships across Staten Island. Maybe you can tell us more about how the center, connects to outside resources and what that continuum of care looks like.
Yeah. So the center helps connect clients to housing resources.
Oh.
We will tell them to, hey, why don't you put in an application for HRA? Why don't you get a housing voucher? This is how you can do it. We also try to get them connected with employment services. So we try to connect them with Workforce One. Sometimes we get notification on city jobs that are being posted. And so we will, pass it along to them. We also try to connect clients to additional rehabs. So if they need a higher level of care, we will connect them to New York rehabs, Connecticut rehabs, New Jersey rehabs, all throughout. It's close to home too.
By-state area, yeah. That's great that there's so many resources.
Yeah.
Okay, so now I know you both work with youth experiencing homelessness and, legal system involvement. So, how do you approach care when someone's navigating so many external stressors? I can imagine that makes things infinitely more challenging. Yeah.
For sure. Safety definitely comes first with that. I have a client in particular who unfortunately has been in and out of shelters over the years, and safety is everything.
Yeah.
He'll come in and I'll ask him, have you eaten today? Like basic needs, right? And we'll grab him a sandwich if he needs it. I've given him like bags of, non-perishable things like that he can just eat easily, whether it be chips or whatever. I'm like, take this with you. Okay, so how are you doing today? Are you safe? What's going on? Do you need any other resources? Do you need any other referrals? Working on mental health housing right now, which is great, so he could be kind of stable. So with that, but safety kind of comes before everything else at that moment, for sure.
Okay.
Yeah, I would say making sure that basic needs are addressed. So like something like homelessness or legal system, their freedom, their basic needs are not being met at that point, or it's in jeopardy. So their substance use is going to go skyrocket, or they're going to have these intense urges to want to use. So we make sure we get that support during that time, especially.
Okay.
Yeah, and we have an infinite supply of Narcan kits too, in that sense too, that we give out to our clients if needed, for sure, for safety purposes.
Okay. And have you been successful with dealing with a lot of these homeless clients, maybe with helping them achieve housing? And
for the most part, I'd say yes.
Yeah.
I mean, there are some clients that don't want to go to a shelter. It's a hard decision.
Yeah.
Some aren't interested in mental health housing. So again, it's all kind of comes back to like meeting the client where they're at. Like, okay, you're not interested in that. what's another alternative? Like Jen was saying before, like, let's figure out something else. What else would feel right to you? Let's work on that. And what supports can we offer you?
And you mentioned mental health housing. Who is that through?
That's through HRA.
HRA.
Yeah, there's an application that can be filled out, and there's a resource called Baltic Street that they help with the application process, which is really helpful because it's a very long application. And they work really well with us. They've been really helpful.
And do they get like mental health support within the housing that they're in? Oh, okay.
Yeah, they have a caseworker. Depending on the level of housing, like there could be like a group home type of setting, so there's 24-hour staff. There could be an apartment program where they're seen once a week, or supportive housing where they're seen once a month, but there's support out there for sure.
And that housing is available on Staten Island?
Yes.
Okay. So now, Liza, you were the first hire at the center before it even had a name. So what was it like to watch it grow into what it is today?
It's been a journey.
Yeah, I can imagine.
Yeah, I remember coming over and not 100% knowing what I was walking into, but very excited about it for sure, and making lots of photocopies of intake packets. And then, it was myself, and then a supervisor was hired a couple months later, and we were kind of discussing, well,
So
what
it's
about
just the
this?
two of you?
Yes,
Wow.
for a while.
Okay.
And like looking at I was literally making copies of intake packets, like really developing it from the ground up. So it's been a wild ride.
And how many people are a part of the program now?
Staff, we have 4 clinicians.
We have Stephen Nico, who was on a couple episodes before.
Yes.
We have Amber Ramos. We're on a couple episodes before.
Mm-hmm.
Yeah, and then 4 clinicians and me.
Very nice.
Yeah.
Okay. And you said about 100-something clients?
Yeah, we're
Yeah,
pushing
about, I
almost
think-
2, right?
Yeah, almost
Yeah.
200.
Wow, that's
Yeah.
wonderful.
Yeah, it's
okay.
incredible.
Making an impact.
Yes.
Absolutely. Okay. So, what would you say maybe have been some, key changes or growth areas that you've seen in the program since it opened?
The growth, it speaks to the need
Yeah.
of the program. I've had a lot of clients come in and say, and families come in and say, we've tried to find mental health services and we were on a 3-month waiting list. So that's something I'll say I'm proud of as the program, that we don't have a waiting list.
That's
like we're able to
wonderful.
take clients on an ongoing basis.
Yeah, but I think that's a very big, factor is that, it could be even just when you're looking for a regular doctor, oh, it's a 5-month wait, like forget it. And you just
right.
brush it off. And to know that, these services can be, something that's so immediately needed, especially if we're dealing with substance abuse. So for people to know that, hey, there's no wait, this change, can start happening immediately. That's very, comforting for people to know that the care is there.
If it's like a hectic time, usually during the holidays,
Yeah.
during times off, we have such an amazing staff that will, if they can squeeze in 45 minutes to do an intake, they will do it, especially if it's a very, very tough case. Like, if they're dealing with homelessness, if they're dealing with maybe heroin use, IV use, anything like that, like we will step in and try to get support and get the ball rolling.
What was it like, going through COVID with this program, and the pandemic change, the needs of the population? How did your team adapt during this time?
We were very small.
Okay.
I actually look back in our admission book. We had 17 clients at the time.
Wow.
And our clinician, Tila, who's amazing,
Yeah.
was hired like the month before, I believe.
Okay.
And then the pandemic hit. So we very quickly switched to Zoom.
I was going to say, yeah, did you become, yeah.
Yes, we did like a complete kind of, we didn't do a shutdown per se, but like we immediately went home and had everything via Zoom.
Okay.
And had to navigate it as best as possible. And then not terribly long after the initial shutdown, we did more of a hybrid schedule, but no clients would come in. We would do still telehealth, either Zoom or phone calls.
It was such an isolating time for everybody, whether you had any issues or not. So did you see an uptick during this time in like the substance abuse? And okay.
I think a lot more parents too became aware, like, these kids are home and they're kind of under your nose, if you will, and the stress is ridiculously high, understandably so. So we definitely saw an uptick. Like it was interesting. In April, there was no admissions, and then May, it was just straight up.
Through the roof.
Yep.
Wow.
Yep.
Okay. And has there been a decline since COVID in that?
In admissions or?
Yeah.
No, I think it actually has increased since.
It's increased.
Yeah.
Wow. And what do
Yeah.
you think has been the cause of that?
I think we're still getting out of the pandemic, if you will. I think that's part of it, and really having this awareness of the mental health challenges. People really wanting to, again, I hear a lot about I'm not going fast enough, I'm not doing enough, and I think that's creating a lot of anxiety. So a lot more people are like, all right, I need support for all this stuff. And because of that anxiety, a lot more of these young adults are using a lot of marijuana, and they're starting to see, maybe I'm using this as a coping skill. I don't know if that's a good or bad thing. I even had a session yesterday where the client was saying, I'm not sure if I'm justifying my use or not. I don't know. And we had a whole conversation about it. So,
oh, I'm sure.
yeah.
And do you have any, success stories that you'd like to share, while keeping the anonymity of the patients,
of course.
but, any big successes of the program that you're proud of?
Yeah, I have a lot, I think.
Yeah.
I hate to sound like that, but I have one client that when he comes in, every time I see him every other week now, he says, this program saved my life.
Wow.
That's pretty huge.
Yeah.
For sure. And that family has actually said to me, you gave me my son back. That's just like so heartwarming.
Of course. That must make you feel amazing.
Of course. We've had clients who went from really struggling in substance use. I have one client who came in for intake that day. I found him a rehab. I'm like, you got to go now. Young kid. He was 16 at the time. Went to rehab, went to sober living, came back, is now getting his GED, doing really, really well. Like total life turnaround.
That's awesome.
Beautiful to see.
Yeah.
For sure.
How about for you?
Well, I don't really see a lot of adolescent clients, but when I continuously see them in the hallways walking and laughing, it really warms my heart to really just see them continuing treatment, to get the help that they need, to continue something that's benefiting them. Yeah. It's amazing to see.
Oh, that's awesome. Well, we are almost out of time for today, but I would like to thank you both, for joining me and for sharing your insights and your incredible work that you're doing at the Center for Young Adults. Your dedication to providing compassionate, developmentally appropriate care for Staten Island's, youth is a huge commitment, to holistic and community-focused behavioral health services. So thank you for all that you do. And, if someone is listening and between the ages of 11 and 24 that may be struggling with mental health or substance use challenges, that help is available. The Center for Young Adults is here to provide support and guidance and a path towards healing for both individuals and their families. And if people would like to learn more about the program or other behavioral health services at RUMC, you can visit rumcsi.org or call 718-818-7038. And be sure to subscribe to RUMC Connections for more conversations that highlight the people and the programs making a difference in our community. So thank you for listening. Take care.